Here's something congressional Democrats don't want you to know. Documents show major corporations are considering dropping health care insurance altogether, instead paying the fines for not having health insurance for their employees. Is there any truth to this? Let's ask Grace Marie Turner of the Galen Institute. She joins the company now. Let me make sure I've got this straight, Grace Marie. Major corporations, there are documents, I believe, which say we're going to drop health care insurance entirely and pay the fine under the health care reform plan because it's so expensive for us to continue to provide insurance. We're going to pay the fine instead. Is this happening?
This is not happening yet, but the bill, despite the president's promise that if you like your health insurance, you're going to be able to keep it, the legislation that he signed, this 2,800 pages of this health overhaul law, contains a very perverse incentive for employers to drop health insurance. They can pay a fine of $2,000 per employee and save the cost of many times that for providing their employees health benefits. So in an analysis that was released, the chairman of the House Energy and Commerce Committee demanded documents from the companies, and this was part of their analysis. I mean, they have a responsibility to their shareholders to look at the impact of this legislation.
Now, and are these documents, aren't these the documents that Congressman Waxman, the chairman of that committee, he demanded to see these documents from these corporations threatening to just drop health insurance coverage completely. He got the documents, was going to hold hearings, and then canceled the hearings. Is that the right timeline? That happened?
That's exactly right. And Stuart, you were one of the first people to break that story, that companies were having to take write-downs because of a change in tax law affecting their retiree health benefits.
Well, this is directly contrary to what the president told us.
Absolutely right.
I mean, if you got an insurance plan that you like, you're going to be able to keep it. Well, that's not true in this case.
He's providing a huge incentive for employers to drop health insurance, put them on the taxpayer dole. This money doesn't go away. Somebody's still going to have to pay these benefits, and the government would have, these government plans would have a lot less incentive to do what employer plans have done to get costs down. The average cost increase for employment-based health insurance has only been about 5 or 6% per employee over the last 5 years. They are anticipating double-digit increases because of the many mandates and requirements that Obamacare would impose. They will look at the bottom line and they're going to say, listen, folks, if we're going to be responsible to our shareholders, we've got to really seriously consider whether or not we could afford to provide this expensive health insurance now mandated by Obamacare. Millions and millions of people could lose their employment-based health insurance, find themselves in taxpayer-supported, subsidized plans, and the price of Obamacare would go 2 to 3 times higher than the already exorbitant costs we're anticipating with this legislation.
All right, Grace Marie Turner telling us how it is. We appreciate it. Thanks very much, Grace Marie.
Thank you, Stuart.